Coming to the imaging studies of liver, ultrasonography of the abdomen is the common imaging modality which can diagnose fatty liver. In the USG, the following features will be seen: diffusely increased bright echogenicity. That means the liver appears hyperechoic and white. Liver echogenicity is greater than that of the parenchyma of the kidney. Deep attenuation of the ultrasound signal is a characteristic feature. The vasculature of the liver will be blurred because of the fibrotic changes and because of the fatty changes. Of course, this will be associated with increased SGPT values, now which can be explained based on the ultrasound or due to the fatty liver. Other causes of liver disease, alcoholic liver disease and medications have to be rigorously excluded before we say with certainty that this picture of ultrasound liver is a fatty liver. So, remember, hyperechoic bright liver shadows greater than the kidney density of the kidney parenchyma, deep attenuation of ultrasound signals and vascular blurring. In the next slide, we will see a few ultrasound pictures of fatty liver. Look here, the picture on the left hand side, very deep hyperechoic white liver compared to the normal liver. The density of this is much greater than the density of the renal parenchyma. This is the renal parenchyma here, and this is the liver, and of course, this is the renal medulla, and the density of the liver is very much increased. We do not see much of vasculature there, hyperechoic shadows of the liver. Similar is the picture in this case also, but this is somewhat less diffuse, more localized in this area, less in the area, whereas this one looks to be more diffuse involvement of the liver with fatty changes. The sensitivity of ultrasonogram for diagnosing fatty liver is 89%, very high sensitivity. That means if you document changes of fatty liver, you are certain to say that there is fatty liver in 89% of the cases. Supposing we are not able to document the changes in the ultrasound, then we can rule out with 77% confidence that there is no fatty liver, but still 23% of the cases may not show changes in the ultrasound. This is what is meant by specificity. Now, let us look at some CT pictures of fatty liver in the subsequent slide. The one on the left hand side is the CT liver of a normal liver, computed tomography. You see the density of the liver much less compared to the bony density, compared to the contrast in the stomach, and compared to the intestinal shadows. But look at the picture of NASH liver, CT evidence of NASH in the liver on the right hand side. The shadows here, hyperattenuated shadows, very white, bands of fibrosis here and there, not much of vasculature is seen, and the density of the liver is comparable to the density of the spleen in the CT. That means there is evidence of NASH and fibrosis in the liver. Of course, as I told you earlier, CT of the liver is generally not required to diagnose fatty liver. Ultrasound will suffice to make a diagnosis associated with other clinical and biochemical parameters.